Abscess is a situation where there is a collection of pus in an area. Here is the facial area. The mechanism of the producing of this abscess is the following. Here we can see some little spot of infection. There is a patient with skin with a lot of grease, and the pilosebaceous ostium is closed. Then the sebum that keep inside of the gland also have bacteria. These bacteria can produce a little infection. These sebum can go out, or it can be retaining. When this retaining under the skin, this abscess is going to produce a necrosis of the surrounding tissue, the fat. Here we have an abscess. I perform anesthesia. After that, a small incision with laser. Here we can see how the pus, the infection, is draining out. And this is very important because if this pus keep under the skin, we are going to have a necrosis and then a depression of the skin. Here we have another abscess, but is more important. The pus, the infection spread under the tissue and produce this big necrosis that you can see in this. Here I introduce a halster in order to show the degree of the necrosis that the pus is producing under the tissues. We must try not to arrive to this situation. Here we can see a little spot of infection, and the idea in medicine is prevention. What we need here is once a month treat the skin in order to disblock, remove the upper layers in order to pilosebaceous gland drain out.